Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
In our pursuit to try to find out things that can affect our lab tests, hydration is actually one of them. And here are some of the things that could happen. When it comes to the hemoglobin hematocrit, dehydration can lead to hemoconcentration. Well, that results in elevated hematocrit and hemoglobin levels. Overhydration leads to lower levels. The red blood cell count can apparently increase the red blood cell because of a lot of dehydration. White blood cell and platelets, too, appear to be elevated in dehydration because there's a lack of plasma. And the electrolytes that you test in your CMP, like sodium, potassium, chloride, well, dehydration will lead to an elevated sodium level or hypernatremia. Potassium and chloride levels can also be affected depending on the severity and nature of this fluid loss. The BUN and creatinine under dehydration situation often can lead and result in a BUN and creatinine levels being higher, whereas overhydration will reflect in a lower BUN. And severe dehydration can potentially affect the glucose as well. It's less common. While hydration has a less impact, but it can affect the TSH, the T3, the T4, and it can affect the protein binding and the transport levels of these particular hormones. Cortisol and stress hormones can increase to a body's stress response, especially if there's dehydration. And transport and binding of hormones may also change if there is dehydration. CRP, the SED rate, dehydration also can lead to hemoconcentration and make these markers off as well. And then when you look at other minerals such as iron, magnesium, and calcium, dehydration can lead to increase in these levels due to reduced plasma volume. Overhydration, dilute these components. So in general, the takeaway is hydration status primarily affects test results through changes in plasma volume, and it leads to concentration of or dilution of blood components depending whether it's hydrated or overhydrated. So be very cognizant of this when you're reviewing lab with patients, as well as determining whether these are significant or not significant. Thank you so much for watching.